Mm. Good evening, everyone, and welcome to our fourth live webinar on cardiovascular pathology. Today, we will be bridging the gap between cardiovascular pathology and forensic medicine. Our speakers are Dr. Shashank Tyagi and Dr. Manoj Parchake, who are junior faculty from the Department of Forensic Medicine and Toxicology, St. GS Medical College and KEM Hospital, Mumbai. Today, they will be presenting cases of sudden cardiac death in unnatural circumstances. The presentation will be followed by a live discussion by our expert panel. I would like to invite you to begin your talk.
So thank you, Dr. Sharanya, for giving us the opportunity to deliver this talk. Just start screening the slides. Okay. So today we discuss about the case series related to the sudden cardiac deaths in unnatural circumstances. Okay. So to start with, death can occur naturally, unnaturally, or as the result of a combination of causes originating from oneself or another. While some cases consist of overt evidence that the death occurred naturally, others required an expert to determine the precise cause of death or combination of causes. So it is very essential for a forensic expert to rule out pre-existing conditions in order to deduce the actual cause of death. In some cases, stress functions as a catalyst that leads directly to death or in association with other disease conditions. So to start with the case first, a 24-year-old male admitted in our hospital with the complaints of high-grade fever with chills, progressive dyspnea, palpitation, and necrotizing fasciitis of left lower limb. Now, patient was very serious, and while asking the history to the relatives of the patient, there was alleged history of inhalation as well as occasional intravenous illicit heroin abuse. Now, as per the based on the clinical and the laboratory investigation, clinical diagnosis was infective endocarditis of tricuspid valve. So as you can see in the picture, the vegetations were preoccupied on the mostly on the anterior as well as the posterior leaflet of the tricuspid valve. The arrow indicates the vegetations which are slightly globular as well as the polypoidal in nature. So after the aggressive antibiotic therapy, patient expired after a few days of the admission. Now this is a medical legal autopsy was performed. On external examination, patient was thin-built, poorly nourished. When we examined the lower limb, there was swelling as well as there is a multiple injection site was present over the left lower limb. There were areas of hyperpigmentation along with the multiple pustules. Now, this is diagnosed as a necrotizing fasciitis of the left lower limb. On internal examination, heart was normal in size and shape. There was heart was dissected inflow and outflow method, and we have seen the large polypoidal vegetations which were present on both the leaflets of the mitral wall. Now the arrow indicates the large globular yellowish to brownish discoloration of the vegetation which were present over the mitral wall. While taking the section for the histology, these were identified as a gram-positive cocci, as well as the fibrin and bacterial colonies can be easily visualized under the microscope. Now, on the histology of the lung section, there was there was evidence of the bronchopneumonia as well as the diffuse alveolar damage, along with the intrapulmonary hemorrhage. So there was multiple macrophages which has been contained the refractile cytoplasmic granules. Now the most of the sections or the few of the sections has been showing the Maltese cross-like material. Along with there is a polarizable granules were seen. Now, for further confirmation, we have confirmed by the polarizing microscope. Now, in this section, you are visualizing the cornstarch as well as the magnesium stearate crystals. And while using the polarizing microscope, we have identified the what type of crystals are there and what is the shape and the size of these crystals. So as we have referred the table of this reference, the round polyhedral shape were cornstarch crystals, which were size of 8 to 12 micrometer, and this appearance as a maltase frost-like material. Now, irregular rounded shape crystals were magnesium stearate. So we have identified the crystals on the basis of this table references. Now, as the discussion point of view, after HIV infection, infective endocarditis incidence is clearly higher among the intravenous drug abusers. Now, heroin is an opioid drug that is synthesized from the morphine, a naturally occurring substance extracting from the seed pod of the Asian opium poppy plant. Now, in India, we have certain states which are legally allowed to cultivate this poppy plants. Now, we have factories also, which is government established factories to extract the derivatives from the opium of the poppy plant. Now, these can only be used for the medicinal preparation as well as the scientific research purposes. Now, according to the UN report, 1 million heroin addicts are already in India, and unofficially there are many as 5 million. Now, illicit substances such as heroin are often adulterated with talc, cornstarch, and magnesium stearate to increase the volume and the weight of the drug. So that is why we have identified which type of adulterant has been present in that uh, lung section. Now, this disease was used to take the inhalation type of heroin drug abuse. Now, chronic inhalation as well as the intravenous drug abuse is a major source of cornstarch as well as a magnesium stearate related lung diseases, which is an incidental finding we have seen as a pneumoconiosis. So, after going through the detailed report of postmortem as well as the histological sections and the circumstantial evidence relative statements carried taken from the relatives, we have given an opinion about the cause of death that this is a multi-site infective endocarditis along with the incidental pneumoconiosis in a chronic illicit drug user. So we have published the article, this case study in the Journal of Forensic and Legal Medicine, cited as both-sided native valve infective endocarditis in a drug addict with the incidental pneumoconiosis. Now the next case, a 25-year-old male, he was brought by the police in the police custody after an altercation. Now, during the detention in the police custody, he suddenly develops the severe chest pain followed by the unconsciousness. He was taken to the nearest hospital for the treatment but declared as a broad dead. Now, there was deceased family has alleged that he was beaten to death in the police custody. So this is a picture of the newspaper clippings where the relatives of the deceased person as well as the friends has agitated. They have made the protest to arrest and suspend the police officials which were involved in that particular time. So 5 cops were suspended following that incident because of this protest. Now the body was brought for the postmortem examination in other tertiary care center. Now during the postmortem examination, the sections of the tissues were preserved for the toxicology analysis as well as the histopathological investigation. Opinion about the cause of death was uh, kept for as a reserve because of this pendency of the investigation. So, owing to the next of kin's demand, body was shifted to our institute for second autopsy. Now, second autopsy was performed in our institute, and during the postmortem examination, we were not able to find out any injuries externally as well as internally. Now, after the postmortem examination, there were initial postmortem report revealed the features of myocardial infarction. So after 2 to 3 months, they have given the cause of death as a features of myocardial infarction. Now we have again analyzed the tissue section which has been collected or retrieved during the first postmortem examination. Now, there was evidence of epicardial coronaries were showing the mild stenosis by the atheromatous plaque. There was intramural coronary artery showed presence of fresh and the recanalizing thrombi. There were multiple foci of healing as well as a healed microinfarcts. So as shown in the picture, this is an intramural coronary artery which shows the fresh thrombus. So after collection of all the reports as well as the histological findings, as well as the most important is the circumstantial evidence and the statement of the eyewitnesses as well as the police officials, we are able to give the final opinion about the cause of death, which was acute coronary insufficiency precipitated by the sudden panic attack. Now, this death occurred in custody. So, this is a topic of discussion. So, death in the custody would include death during the initial confrontation with authorities, during the process of arrest, transfer to a facility, or during incarceration. Now, differential diagnosis could be anything, whether it's a death due to self-inflicted traumatic injury, whether it is application of appropriate or inappropriate physical restraint, whether it is due to the stress-related exacerbation of a previously known or unknown medical condition, which is exactly happened. The person was suffering from pre-existing heart disease. Now, due to stress-related environment, he develops a heart attack, or you can say another cardiorespiratory attack, which is due to sudden cardiac attack, sudden cardiac death. Other causes are effects of the illicit drugs. So we have preserved the viscera internal organs for the chemical analysis, for the toxicological analysis, which were negative. Now, the term sudden cardiac death was defined as sudden unexpected death during or immediately after experiencing an acutely stressful event. Now, this stressful event could be anything, whether it involved the physical restraint, any verbal altercation, any stress during the exams, schools, or job stress, receiving bad news or dying in the police custody. So, again, that could lead to the stressful environment, which is very harmful to the human body. Now, it is estimated that at least 20% of episodes of ventricular arrhythmia of sudden cardiac death are precipitated by the emotional stress. Now, the probable mechanism could be related to an intense release of catecholamines due to stress. So, we have seen few of the cases where there is a scuffle between the two person and followed by the unconsciousness of a person. Now, he was declared as a broad dead case, and during the postmortem examination, we could not able to find anything on the gross examination as well as the histological examination. So the proper explanation or most likely explanation could be there's a consequent increase in heart rate, respiratory rate, hypertension. There's a greater myocardial oxygen demand as well as the consumption that could lead to hyperkalemia and increase the number of muscle enzyme due to the rhabdomyolysis. Again, which contributes to the coronary vasospasm. Now, this coronary vasospasm that would create, it will help for 1 to 3 minutes after the physical activity. Now, which again combined with the hypokalemia, which again lead to the coronary vasospasm. Now, this vasospasm creates a ischemia followed by a cardiac arrhythmia. So, in postmortem examination, you will not find any gross evidence as well as the histological examination. You will not find anything. So, what would be the take-home messages? In cases of drug abuser, you have to examine the lower limbs carefully because this is the most site where the person or the drug abuser can easily hide over the clothes. So it is the duty of an autopsy doctor that he has to carefully examine each and every limb properly to inspect for the injection sites. In case of infective endocarditis, it should not be always on the right side of the heart in case of intravenous drug abuser. So we have seen the cases, it has been reported that intravenous drug abuser has most commonly side is right sided of the heart. So there is rare entity that both side of the heart can be involved, like in this case. So ancillary techniques to be used to demonstrate and confirm the type of substance abused. This type of uh, drug has been used by the drug abuser. What is the constituency of that drug? which type of adulterant has been mixed in that drug. So we have to find out by doing the special techniques like spectrometry, like enzyme immunoassay technique. So these are things can identify which type of adulterant has been added. So we during this I remember one of the case that doctor has committed suicide by injecting herself injection of panchromium bromide. Now this drug is a anesthetic drug. So this is a broad dead case, and we have during the postmortem examination we have preserved multiple samples like CSF, like vitreous humor, blood, urine, internal organs for the chemical analysis. But unfortunately, we do not find anything in the chemical analysis report. They gave as a negative report. So the better understanding, so I asked to the chemical analyzer in the forensic science laboratory, so what could be the reason? So they suggested that they do not have the standards sometimes of that particular drugs. So my suggestion is we could preserve some samples for ourselves to do the screening as for the diagnostic of that particular drug. Now, this container is available in the market at the limited cost. So we can collect the urine sample of the alive person as well as the diseased person who is allegedly drug abuser. So that could give the different color discoloration. According to that, we can assume that this person is consuming this particular type of drug. So as per this container, it can identify up to 12 different drugs like benzodiazepine, barbiturates, tetrahydrocannabinol, cocaine, oxycodone. Now, this type of drugs can be easily detectable if we preserve small amount of urine sample, or we could send to the private lab, private hospital. Like in Mumbai, we have Hinduja Hospital. So during the when the patient is admitted in the hospital, so physician can send the samples, blood sample or urine sample to the private labs for detection or for diagnostic purpose. In that case, because usually the forensic science laboratory takes around 2 to 3 months for giving the reports. So in that period, we can reduce the time as well as we can direct the investigating police officer for the that please find out this particular drug that person is consuming, and because of that person has died. Now, for the second case, coronary artery disease should be suspected in any age group. Now, we have seen the many cases where the young adults have the 80% to 90% block by the atherosclerotic plaque or the thrombus. So, it is the duty of a autopsy surgeon that he has to carefully examine each and every artery section, especially the heart. He has to take the sample of each part of the heart and send it for the histopathological examination. Even in unnatural circumstances, look for the coronary artery disease. Suppose, especially in the road traffic accident as well as the train accidents, when the person is driving a vehicle and he sustained a heart attack in between the journey, due to which the accident has occurred. Now, as per the injuries, we can say that injuries were less minor, and the more there is a more evidence of coronary artery disease. So we could able to tell the manner of death whether it is a natural or unnatural. This could help in the insurance policy. Like certain insurance, there is claim that a person can get the more benefit if the person has died due to natural cause. So we can say that especially in cases of stress related condition, so we have to find out, we have to take proper history from the relatives of the diseased person and under which stress the disease was at that particular time. So this is it for my point of view, and now I like to invite Dr. Manoj Parchake for his presentation of cases.
Thank you, Dr. Shashank. I will continue from case 3. So, 31-year-old male had a complaint of chest pain. Deceased was a construction worker at a local building site. On the day of incidents, while working at a construction site, he suddenly collapsed and sustained injuries. He was brought to our hospital where he was declared broad dead with history of accidental death while working at building constructions. On external, on external examination, we noted minor injuries such as abrasion. On opening the thoracic cavity, we removed the heart-lung block and we found partial pericardial sac, which was 4 centimeters from the apex and completely encircling the myocardial wall. And the circumference of the pericardial sac was 21 centimeters. On opening the pericardial sac, we found impression of the rim of pericardial sac on myocardial wall. Also, coronary artery along the rim of the pericardial sac were narrowed and constricted. Strangulation of heart was very rarely reported in the literature. In adults, it was mostly seen in cases of post-cardiac surgery. Caracad and Puva Bandiston reported death due to strangulation of heart in infants. In present case, there was ventricular herniation of the heart from congenital partial pericardial defect over the ventricles. Pericardial rim caused constriction of the ventricle. There was evidence of luminal narrowing with the evidence of thrombus at the level of constriction. Final opinion of cause of death given as strangulation of heart due to partial pericardial sac. This case we have published in Egyptian Journal of Forensic Science in 2016. Now case 4. 15-year-old male student brought dead in casualty. He went to his friend's house for the purpose of studying, then came back and slept. Relatives, when tried to wake up him, they found him unconscious. Relatives were suspecting poisoning. On examination, there was no evidence of injuries externally or internally, and no evidence of poisoning. There was history of mild fever 1 week prior. Also, there was history of feeling dullness, joint pain since 1 day, and the disease was non-smoker and non-alcoholic. On cross examination, there were no significant findings. On histopathological examination, we noted disruption of myocardial fiber due to dense lymphohistocytic infiltration, which suggests myocarditis. Myocarditis is a rare, potentially life-threatening inflammatory disorder of the myocardium. It is a common cause of heart failure in otherwise healthy children. Myocarditis can be caused by a broad range of infectious agents, including viruses, bacteria, chlamydia, rickettsia, fungi, and protozoa, as well as non-infectious triggers such as toxins and hypersensitivity reactions. In myocarditis, there is evidence of broad range of symptoms from asymptomatic to presenting signs of myocardial infarction. Commonly, flu-like symptoms, mild symptomatic, dull feeling, or in severe cases, chest pain may be present. In present case, there was history of flu-like symptoms, and these symptoms match with myocarditis. Myocarditis is an underdiagnosed cardiac disease resulting from broad range of infectious, immune, and toxic causes. High degree of suspicion is required by the health practitioner of patients suffering from flu-like symptoms, whereas investigation will also help in diagnosis. There should be research on myocarditis, so it will help to decrease the incidence of sudden death by preventive measures and to decrease the risk of sudden death in family members of it. Take home message in case 3, that is strangulation of heart due to partial pericardium. In situ examination is very important. It highlights rare congenital anomaly can cause sudden cardiac death. In case 4, that is myocarditis, it shows importance of documenting by taking multiple section of myocardium. So study at all level like apex, base, anterior wall, posterior wall, and interventricular septum is required. So now this case 4, that is myocarditis, this case was published in news, stated that 15-year-old high school student dies of heart attack. So it is a general belief of our society that anything related to the heart is that the death is caused by the heart attack. So it is a need of an hour to sensitize our society regarding the sudden cardiac death and to explain them that everything is not a heart attack. Hence, it is very important for autopsy surgeon to conduct meticulous dissection of the heart. Sudden cardiac death registry or center. In India, the level of coverage of vital registration and the reliability of the cause of death as stated on the death certificate is often low, especially in the rural areas. The incidence of sudden cardiac death is on the rise, especially in the urban region. This may be due to the increase in prevalence of diabetes, hypertension, and also changes in the lifestyle of the people. There is need for establishing collective measures in estimating the incidence and the risk factor of sudden cardiac death across various regions. A core component of this initiative will be creation of National Registry of Sudden Cardiac Death that will capture essential epidemiological data and provide a method to audit current autopsy. So thus it is a need of an hour in 21st century establish sudden cardiac death registry or center and to work in collaboration with the forensic faculty, with pathologists, so that we can establish such type of center and prevent future deaths. A big thank you to Professor Dr. Pradeep Vaideshwar sir, Dr. Saranya Singreval, and organizing team. Thank you.
Thank you for a wonderful presentation, Shashank and Manoj. Before we open the topic up for discussion, we had a few announcements for you. I would just like to let everyone know that the group has started a newsletter, and if you would like to subscribe to it, you will find details on our Facebook page as well as the Facebook group. It's a monthly newsletter, so you're also welcome to send us contributions for inclusion. If you would like to find out more about the investigation of deaths in India, you can watch a new video that's been created by Shashank. Again, you'll find links on the Facebook page and the Facebook group. The 29th of September is World Heart Day. So again, we have a surprise coming up for you there. So stay tuned. I would now like to open the topic up for discussion.
Can I start?
Yes, ma'am.
Okay. All the cases were very, very interesting and unusual. And what I found most surprising was all the patients were young. I'm sure there must have been cases of older individuals with where you face the problem of sudden cardiac death.
Yes.
Now, coming to case one, why was it really a medico legal autopsy? The patient was there in the hospital for a couple of days. He was diagnosed as infective endocarditis, history of drug abuse, and so on. So, why was it a medico legal autopsy? That is number one. And secondly, it is not surprising that we expect drug abusers to usually have right sided vegetations. But with the lung showing bronchopneumonia, etc., the infection can easily pass on to the left side of the heart. So that is unusual explanation. And third is, was the patient HIV positive?
Yes, ma'am. Ma'am, for first question, ma'am, it's a medical legal case because there was alleged history of intravenous as well as inhalation drug abuse, that is the heroin. So we have to inform to the police so that they can book the case as a medical legal case and they will investigate. So whether he has found the drug and whether other peoples were also involved in this drug abuse or not. So that's why we have to perform the medical legal autopsy. And so we have kept the samples also for detection of drugs. So if everything was okay, like if we detect a certain type of drug was there, so we have to inform to the police. So he will investigate in that particular matter. Second question, ma'am, the patient was not HIV positive, and as per my knowledge, both sided of like multi-sided infective endocarditis was rare. So that's why I have given the explanation.
And coming to the second case, this was a re-autopsy, right?
Yes, ma'am. Second postmortem.
Uh, uh, do you face problems while doing a second autopsy or a third autopsy because it would have already been messed up
Yes,
by
ma'am.
the previous autopsy doctors? So, one is, how often do you get to do a re-autopsy, and what are the kind of problems you face while doing a re-autopsy?
Actually, re-autopsy is done usually by the if the investigating police officer is not satisfied with the cause of death. And other thing is the relatives are not understanding that they are receiving the fact about the cause of death, how his or her relatives has died. So they demand for the second autopsy. So it's up to the investigating police officer. Like he can approach for the different institute to conduct a second autopsy. So, ma'am, we are getting like not as this is a police custody death. So, as per the NHRC, like National Human Rights Commission, we have to perform the as per their protocols. So, it is not very common, but still, if the protest is there, the peoples are very agitated. So, uh, according to the police officer, we can conduct. Like in during the second postmortem, we do not file like we do usually do not find any findings, but we have to trace out any finding which has been missed in first postmortem examination, and we have to reanalyze the sections which has been taken during the postmortem examination.
In the first case, did you send samples for drug analysis? I mean,
Yes, ma'am. We have sent the viscera as well as other body fluid samples, but that came.
Okay. We have a couple of questions through our Facebook chat. And the first question is for Dr. Manoj. Partial pericardial sac, what do you think is in your opinion, would have triggered cardiac insufficiency on the day of the incident?
As the heart is can adjust right from the birth as per uh, the partial pericardial sac. So heart has a very high um, capability to adjust with the partial pericardial defect right from the birth. But what happens after, as the person grows older, So because of the uh, other factors like stress and as the heart is completely pumping and as the position of the heart is not constant, so hence there is always a chance in diastole that there will be increase in compression of the coronaries and that can lead to the uh, ischemia.
Okay.
Is it related to any kind of physical stress that there is a herniation of the heart through the defective pericardium?
Yes, madam. There is possibility of physical stress also.
Okay.
Disease was a constructing worker.
Yeah, so that's why I was asking this question that, that very significant physical activity could have provoked the herniation.
Any comments from Dr. Jatin?
Yeah, sir. Thank you, sir. Hi, Shashank. Hi. So I would like to ask you regarding the second case.
Yes, sir.
I'm sure that you must have faced a lot of difficulty during the second postmortem
Yes, sir.
examination. And you did a great job in meticulous examination. You did the history, toxicology, histopathology also.
Yes, sir.
But as we know that we are bombarded with the questions and with the police asking to rush with the report also. So I would like to ask you how, and I would like to ask Dr. I would like to have Dr. Pradeep insight on this question also, that how important in this particular case to rule out CPBT.
To rule out what, sir? So your voice is cracking.
How pertinent, how important to rule out CPBT. CPBT.
So you could
No,
tell
I
the
did not get it. Is it a short form?
Yeah,
Yes,
yeah,
sir.
short form.
What is it?
What is a full form?
Catecholinergic polymorphic ventricular tachycardia.
Oh my goodness. You sound like a cardiologist.
So he is
Yeah,
almost
I
cardiologist, sir.
So, sir, it's very important, it's very pertinent also, because in our scenario we are not equipped with this kind of genetic things that we should have. But Shashank, as far as Shashank is concerned, he did a meticulous job, I would
Sir,
say.
yes, sir. For
But
further analysis, we can move on to the molecular autopsy. We can set the tissue blocks
Right.
for the mutation, like for detection of mutation. But
Yes.
or we can, but mostly we have to do the cause, like we have to give the cause order as per the circumstantial evidence. So that's we are
Right.
actually doing. That is not a correct, but still we have to do the other techniques to find out the real cause of death.
But at the end of the day, when we don't have anything substantial, anything significant at autopsy, so pathology is completely insignificant. Autopsy finding grossly, we didn't find anything. So means how I don't know how to frame this thing. But
I
are
agree, sir,
we compelled to give some cause of death in this
but sir, we do
scenario?
not have
Means,
any choice. Like,
Yeah,
or we
that's
can
true.
molecular autopsy, sir. We can propose. We can send the tissue blocks to other institutes like international institutes to find out the real cause of death. But that will take more time, and because the family has to claim the insurance, so we have to give the cause of death. Also, it has to go to the court. So this we have to do like within a span of few months. We cannot wait for the know the exact cause of
Yeah.
death as per
And
molecular.
and unfortunately, there are only very few centers who are actually doing this molecular analysis. There is a center in Bangalore, and there's a center I think somewhere in Kerala also. But somehow they are not too receptive in accepting samples from outside institutes. And then there's a question of payment also, that who is going to pay for all, because it's quite expensive. So there are too many
yeah.
issues, and ultimately it boils down to money as well as further, delay as far as the police is concerned, the courts are concerned. the insurance companies are concerned. So somewhere we have to, what shall I say, find a easier path so that no one is troubled. I mean, this is not the correct way of doing, but unfortunately we are forced to do because of those
Yeah.
circumstances.
Can I have a comment now, please?
Yeah, yeah, sure.
Yeah. So thanks for the excellent cases. So regarding the genetic analysis, what we say, the autopsy negative cases where you definitely need molecular studies. I have taken up a project regarding sudden cardiac death in young. Am I audible?
Sir, your voice is cracking.
No, your voice is cracking.
Am I audible?
Yes,
Yeah.
now
Now you're
yes.
So recently, one of my project got sanctioned regarding the evaluation of sudden cardiac death in young individuals to identify the molecular parameters which causes it. So after this COVID started, I never had any samples. So what I'm suggesting you people is, so in case, so we can develop a collaborative work together
Yes,
with
yes.
the forensic,
Oh, that
but
is wonderful.
yeah,
Yes, we have a lot of cases, sir, like
yes, I
this.
mean the same thing. I think same thing is
Fazil sir
lacking
will
in
be happy.
India. Yeah, I know. With the guidance of Dr. Pradeep only, sir. He is very motivative. Thing is, so we, as you rightly mentioned, we don't have any national registry. So because it is the initial naive stages, I will try to do a few molecular mutations which is responsible for individual diseases. We'll see the baseline parameter across India, how it is there. We can develop a registry. Later on, we can go for multi-institutional project along with Department of Forensic Medicine all over India.
Yes.
We can develop, we can go ahead with Jaya ma'am and Pradeep sir's guidance. So we can develop a national registry. So we need full support from forensic. So for time being now, so if you want to send a sample for even we don't know exactly the incidence of genetic mutations of hypertrophic cardiomyopathy or dilated cardiomyopathy in India. We always refer to the Western literature. So we want some kind of Indian data regarding this myopathies. So if you have any kind of a clear-cut case of DCM, HCM, we can, I'm happy to take you better. What you should do while taking autopsy, take a small part of spleen or a blood, store it in -80 if you have, and you can send it to me. So I can give the results. It will take time because it is a project work, but I'll give you the results. So we can, it should be more of an academic. Once we
Yes, sir.
standardize all the protocols,
Yeah.
then it will be easy. So initial
Very good
standardization.
initiative, sir.
Yes,
Very
sir.
good initiative.
And
Thank you, sir.
regarding
Yeah. Yeah,
myocarditis,
yes.
now we have standardized two markers, human herpes virus 6 and parvovirus B19. So I got few blogs from Dr. Pradeep sir. Out of those blogs, two came positive. So actually, the
Very
nice.
B19 positive in a case of myocarditis. So we'll work on adenovirus and Coxsackie virus. We'll standardize that also in near future. So all of us, if you have any case of myocarditis, you can send it to me. I'll give you the results. So this will go on from now onwards as a collaborative work. So we'll expand our network throughout India, and we'll try to come out with some results, good results. And the virus incidence and
Yeah.
geographic variation of the viruses we can do.
that we can share it.
No, and in fact, Dr. Sudhir is also exploring the possibility of creating a society
Yes,
so that
please.
we will have some kind of a standing at least in this region. So that
Yes, sir.
also is going to
Guidance
help
also.
us in the long run.
Yes,
Yeah. So
definitely, sir.
Sudhir, very good. If you're doing all this, then excellent.
Yes.
You might be inundated with samples.
Yes, sir.
No problem. We'll do that, sir. Even and even one more information. If you have any cardiac amyloidosis cases, we're happy. Presently, we have transthyretin mutated antibodies. So we can do transthyretin if you suspect clinically. We'll be procuring a panel of antibodies, kappa, lambda, and also serum amyloid protein, whole panel. So we'll start with this, then we'll go for final mass spectrometry in future if you get funds. So we will also develop, these are the unexplored areas in cardiac pathology in India. So we'll go ahead with this and
And all these services are free.
yes, yes. If you get that project, no need. We need.
That is a very important question for
Yeah,
all
I
of
agree. I
us.
totally agree. But results will
For
be little
anyone
delayed
on
because
Facebook who doesn't know, this is Dr.
Yeah.
Sudhir Arava from AIMS, and you can find him on social media, or you can get in touch with us, and we'll help you get.
you can is not a problem. But sending results will be little delay because along with the routine
So
work
that's no
and
problem.
this thing, no
Yes,
problem.
yes.
Yes.
So for academic purpose, any kind of a thing, so we have to develop some standards in diagnosis.
Definitely.
That will go ahead.
There are
Thank you very much.
Shashank, can I ask?
Yes,
there
ma'am.
are actually a couple of questions from our Facebook feed. So if we could take one of those questions. If there are no gross and histological findings found in a case of heart disease in natural death, on what basis can the cause of death be given?
Basis of circumstantial evidence. So we have to gather the information from the police investigating officer. We have to gather the information from the eyewitness, relatives of the deceased person, whether personal history, family history, whether he is suffering from any previous disease or not. So main the circumstantial and the corroboration the cause of death. So you have to find out these.
One more question. Was a hair sample sent for drug analysis in the first case, as drugs having rapid metabolism may not be detected in routine samples?
Yes, we can send the hair because heroin can be easily detectable in urine up to 3 days, and in hair we can detect up to 90 days. But first you have to ask to the forensic science laboratory, like whether they can do the analysis through on the hair or not, or this type of sample they can
Hmm.
easily like retrieve the poison or any drug. They usually ask the blood because they have to run through the gas chromatography. So they usually ask for the blood also.
Okay. If there are any questions.
Shashank,
Madam
can I
Pandit,
Yes, ma'am.
see? I had studied some cases of right-sided endocarditis
Yes,
long
ma'am.
time back, more than 30 cases, and especially in case of drug addicts, double valve infantile endocarditis is very common. All other causes only right-sided, but if it is because of infantile endocarditis, both-sided valves are very often involved. Of course, what were the findings in the lung beyond cases? In your case,
So, ma'am, it has incidental pneumoconiosis.
no, that apart.
And
Ma'am, this
Was it
is
any
and
infarct,
bronchopneumonia
emboli,
with diffuse
bronchopneumonia.
alveolar damage.
Yes, along with the hemorrhage, pulmonary hemorrhage also.
No, but there were emboli, pulmonary infarcts. Anything
No,
of that sort?
No.
It's very
yes,
common in right-sided endocarditis.
yes, definitely.
Yeah.
And secondly, how many cases of autopsies of drug addicts do you get?
Not much because like this area where we have 5 to 6 police stations designated to the KM hospital. So we do not have the much drug-related deaths. Usually we have 2 or 3 in a month.
I wish your department can develop a laboratory
Thank you,
for
ma'am.
drug
Recently, the
analysis.
MCI has like issued a
Yeah.
circular. Medical Council of India has issued a circular that each medical institute has a toxicological lab along with the biosafety level.
Exactly. That is the need
So
of the hour.
yes, ma'am. So we are
Yeah.
Swami would be
working.
interested in this.
Very, very nice cases. All
Thank
of
you,
them.
ma'am.
And one thing what Shobna madam has mentioned, recently we had a case. So always in drug addicts, they are very clever. You don't know, they not have single drugs. They will be having multiple drugs, multiple inhalation, multiple slides. So recently, around 3-4 months back, we had a case of Northeast student, 25 years. He died due to drug abuse. Circumstances was due to drug abuse. We did not find any evidence of endocarditis in heart examination, but the lung parenchyma, whole of the lung parenchyma, each and every blood vessel is studded with this drug particle and giant cells. They're
Oh
all
my
blocked.
God.
They're all blocked. So then we inquired. Later on, we found out that so what these people will do when they don't get IV abuse drugs, the oral taking drugs, they will take out the capsule, they'll powder it, they will mix it in water. They are water insoluble. They will try to inject in the vein. Those insoluble metal which goes and blocks all the pulmonary vasculature, and actually the cause of death due to diffuse pulmonary embolism due to drugs,
Hmm.
and
Exactly.
all blood vessels were blocked.
Hmm.
So cause was that.
I
So
think, I think Dr. Shivraman had one case in 1994 which Madam had presented at one of the meetings. If Madam remembers that, the starry sky, the
I
star
remember,
case.
but I can't say anything much. You will remember better, Pradeep.
I think it was presented in the senior surgical.
Senior
Yeah,
surgical,
yeah.
yes, it was, yeah. It was called as a star case because that polarizer showed lot of
Starry
those
sky.
polarizing material, yeah.
Okay, so
Anybody studied conduction system in cases of sudden cardiac death?
Yeah.
Sorry, ma'am.
Relevant question.
Anybody has studied the conduction system in sudden cardiac deaths?
No, we have to start, ma'am. Still now we have done, we have to start. You are exactly right, ma'am. That is the neglected part. So we'll start, ma'am. There are a lot of queries regarding that. We'll go ahead. We don't have much experience regarding that. So once we start, we'll continue.
But are
So,
there
like,
any reports?
Sir, I would like to add.
oh yeah, sure, Vinod.
Actually, I am Dr. Vinod, Associate Professor of Forensic Medicine, JIPMER. Actually, I want to add, when there is a sudden cardiac death and trauma is involved, means trauma as well as unnatural event and sudden cardiac death is involved. So when we are giving cause of death as a forensic specialist or pathologist, in that case, we have to see what is the predominant component. There are three scenarios. One will be the trauma is a major component. Second, sudden cardiac death plus trauma, both will be there. In that case, sudden cardiac death will be major component and trauma will be the minor component, which is like an aggravating factor.
Yes, sir.
Understand?
Definitely.
And third will be the only sudden cardiac death will be the major factor where there is no features of trauma or no features of injury. So that is a three thing. Other aspect I want to add, where scenario like you explain in custodial death without any trauma, he became unconscious due to the chest pain and other thing, and he died of myocardial infarction. Similarly, when person push other person, elderly person already has a coronary atherosclerosis, okay, over the period of time, and suddenly pushed by another person, the police may think it is a case of assault or culpable homicide or murder. Even relative will allege. In that case, such scenario we are facing over the time. So in that case, we have to meticulously do autopsy as well as the histopathology so that
Correct.
we can get the proper cause of death, where trauma component is there or not. And while writing the cause of death, where basic cause of death or antecedent cause of death, we should write sudden cardiac death like coronary atherosclerosis, or acute coronary syndrome or acute myocardial infarction. And other significant condition we can write as a trauma, whatever. That is contributory cause or it is a like aggravating factor.
Aggravating
factor. That we can write. Okay, thank you. Very good presentation, both of you.
Thank you, sir. Thank you.
Thank you.
So we have friends from, as far away as Brazil and Hungary who say hi to you guys and who are
Oh, hi.
Hi. Hello.
Hello, Shashank. Manoj.
Yes. Hi, sir.
Yes, sir. How are you?
Very
Sir?
nice presentation.
Thank you, sir.
Fine.
You're supposed to give the presentation,
Nice
but
presentation.
due to some work.
Yeah.
No.
No.
Yeah.
Yeah, excellent presentation, Dr. Shashank and Dr. Manoj. I had a question to this panel. Can I ask? Many times when we do this autopsies, along with a cause of death, like say bronchopneumonia, or along with that, many times we get like acute coronary insufficiency, like though the patient may not present like with cardiac, so how much importance should we give that? Because most of the times our residents are happy finding acute coronary insufficiency and giving it as cause of death, but many times we do see like a single or a two vessels with 75%, but the patient has died of some other cause. So I mean, we include it in cause of death, but what is your experience, Pradeep sir,
No, like for example, I think maybe we can, expand the definition of sudden cardiac death. So what we usually do if a person is admitted for some other condition and then the person is either treated conservatively or given a specific surgical therapy or interventional therapy, and if during that course if he dies suddenly and then we find that there is significant coronary atherosclerosis, then I would take this atherosclerotic coronary artery disease as the culprit lesion for producing
Primary.
this death. Otherwise, it may be just like a finding in that particular autopsy because the patient will not have any symptoms related or he doesn't die suddenly because of that. So that is how, I mean, I look at things at autopsy that way.
Means of late we are seeing many cases with single or double vessel, like, more than 75%, but not actually like dying because of some other cause. Like,
Yes, yes.
so,
But it has to be
we are,
documented. Correct.
yes,
Yes.
yes, correct. Excellent talk, Dr. Shashank and Dr. Manoj. Really
Thank
nice
you.
cases.
Can I add a point to this one? I am Dr. Nagesh.
Nagesh from
Sure.
Father
College, Bangalore. So this type of situation where we see actually like a double vessel block and all those things, even in incomplete this one. So in such situation, especially, I mean, when we do medical legal case, first we see the history, what is given by the police as well as if relatives are there, then we try to get the history and we try to rule out the other possible causes. So along with that, actually we keep the all the organs, and we try to rule out the other possible cause of death. And in case if any suspicion of even any poisoning and all those things, so that viscera will be kept and that also will be ruled out. But in not all cases, only like if you find any some finding in the autopsy where it is warranted that to keep the viscera. So by ruling out all these things and by considering the history, so then we consider even though if it is like a insufficient block is there, and then we give the cause of death. Usually we go like that in actual cases.
Yes.
Thank
Yes.
you.
Thank you very much. Yeah.
Rinda Patel thinks it would be really nice if in future discussions, dissection and study of the conduction system of the heart is explained, as it is quite difficult to locate it and there is very less literature on the subject.
Does Dr. Ivana have any experience?
It's like actually, sir, earlier on she told me that she would need to leave during the meeting because she...
Oh, okay.
No, she's there.
Yeah, I am.
Yeah,
I am here. Yeah.
Oh, okay. Yeah.
I have to tell that I have quite limited experience. Yeah.
Okay.
But
I think we, Deshpande madam had given her student a thesis about looking at conduction system. I remember when madam was at Nair. So we had looked at it, but it was really difficult, but we could identify it looking at that vessel, and we had to take multiple sections.
Yes.
At least 12 blocks. So more than 20 to 30 blocks to identify SA node and AV node.
It is way above our pay grade.
Yes.
But I think it would be interesting, sir. Maybe, we could include it as a part of one of our webinars or a separate webinar.
For example, in all the cases where there is no, when the heart is normal with sudden death, I have taken a section. I used to take only 1 or 2 sections from SA node and AV node. So this experience also is limited. Means that we don't have funding for that extensive work.
So many blocks.
That way.
I know that
too many.
I know that some laboratories are using these macro blocks that they can have a larger area in one block. So it's like an embedding of a bigger part, because otherwise that's true that it's at least 20, 30 blocks to be sure, and it's quite laborious. So in routine autopsies, it's a little bit impossible to do it. But I think that there are definitely cases where it bears doing.
I don't think
in fact, I have seen.
I don't think.
No, in fact, I had seen in Dr. Mary Shepherd's laboratory that they take a mega block Means, for example, if I want to study dilated cardiomyopathy, I take only the cross section, and the entire cross section is cut, and we get. I mean, it is just wonderful to look at those sections. I don't know how it is done. I don't have the courage to ask how it is done. But it was really wonderful to look at.
I don't think anyone is using mega blocks anywhere in India. At least, I've not heard of it.
No, not
Even
at all.
started using it, in the NHS for, breast biopsies, because you can see 4 margins in one go, which I thought was really interesting.
Right.
I don't think anyone has really adopted.
Yes.
Yeah.
Special microtome knife to cut, like we used, Madam used, Dr. Kinnari used to have whole lung sections.
Yeah, correct. Something like that. Yes.
I was just, can I?
Yeah, sure. Sorry.
Yeah, I was wondering, can we use tissue microarrays to identify, to identify the conduction system, like using one single block and having multiple, cuts on that? So can we use tissue microarrays?
No, I don't think, you cannot use that. Is only for molecular or IHC analysis.
Okay.
For morphology.
Okay.
No, and unfortunately for the conduction system, there is no specific IHC.
Yeah.
That's what we
And
need.
I mean, even when you take sections, it is so difficult to identify. So there's no question of using microarray at all.
It'll be very tiny.
Yeah.
Okay.
I think we should together develop some special stains or something to identify, because this is the autopsy is fine, but the same problem is there in live patient when they do cardiac surgery, congenital heart surgeries. They want to identify the conduction system to unnecessary takeout, and the patient will subject with. They always ask this question: do we have any stain to identify the conduction system live? So we have no answer. I think someone should explore in this.
Yes. So that is Sudhir, aiming high. He's from AIMS.
Yeah.
So aiming high.
So I don't think there are any more questions or remarks on the Facebook page. So if anyone has any more questions to ask?
The last one comment, sir, because all of us were gathered here. So I think we should develop one pro forma for sudden cardiac death cases.
Yeah.
So that anybody have anything, they should go. This pro forma should be circulated amongst all of us. And they have to just note down all relevant findings, what all, because some newcomer, if he doesn't know, he can miss the things.
Yes,
So I will make a rough pro forma, I'll send it to you, sir, and ma'am.
Sure, very good.
Make it, and what to collect, what to look, the measurements, whatever. Then during
excellent.
Another 3-4 years, we'll have some data. We can
definitely excellent. Yes.
Excellent.
Yeah.
Sounds promising.
Are there any more questions or comments?
It is wonderful that forensic department is taking interest in such cases and participating. It's wonderful, really. Keep it up. Keep it up.
No, no, Dr. Jatin had gone abroad to Canada and he specialized there. I mean, very happy to hear all that. Yeah, that is really excellent.
It is very important for collaborating with pathology. Otherwise, we find a lot of difficulty in giving cause of death.
Yes.
When Dr. Muktabai, when I was in Dr. Muktabai helped a lot for me in giving cause of death. So I really remember Madam a lot actually.
Right.
We are lucky that in our institute, pathology department is very cooperating, especially the Pradeep sir.
No, it is. No, I feel sometimes I'm drinking tea in the autopsy room. It's almost like that. Yeah.
Any more comments or remarks? Okay, so our next webinar will be on the 26th of this month, and that will be on cardiac pseudoneoplasms, and it will be by Dr. Philip Templo from the Philippines. So it will be really nice if everyone could come back for that. Please follow, our Facebook page and our Facebook group, because you'll find all the updates there. And don't forget to subscribe to our newsletter.
Thank you, Sharanya. You've been
Thank you very
amazing.
much.
Like,
Thank you.
Very much.
Bye-bye.
Thank you.
Thank you, everyone.
Thank you.
Thank you,
everyone.
Thank you, Shashank. Thank you, Manoj.
Thank you, ma'am.